Can your doctor suddenly stop prescribing opioids? As a short answer, they're not supposed to. There are guidelines. So we're talking about people who are chronic pain patients who have been on opioids for quite some time. And there's been a lot of issues out there that physicians have, criticism that physicians have been over-prescribing opioids. It's best for everybody to try to minimize how much of an opioid a person is taking, and so it is incorrect for physicians to misinterpret this guideline. The guideline, it's only a guideline, it's given out in both the United States and Canada. It's stating that there is a goal of a maximum of 90 to 100 morphine equivalents per day that a person should be on. And that if a person is on more than this, that they should be weaned down. So it is completely unacceptable for a physician to suddenly stop prescribing an opioid for somebody, because this is going to precipitate withdrawal, and this person is going to be desperate, and is not a far-fetch for them to go looking on the street for drugs. And that's what physicians need to avoid doing altogether. It is a form of abandoning your patient as well, so it's definitely frowned upon. Some physicians have misunderstood these guidelines, thinking that they would have some consequences from their licensing authority should they have patients on more than the recommended amount per day, but this is untrue. It is a myth. They just need to document. That's the most important thing, is to document a conversation that they've had with the patient, and to see if it's possible to try to wean them down, and see what the consequences, what happened as a result of weaning them down. Some people can be successfully weaned down to the standards that are suggested, but some people don't do well with this, and perhaps they were weaned off too quickly, or weaned down too quickly. There's nothing out there that says that a physician needs to get a person off their opioids. It's more or less guidelines saying that they should try to be weaned. If there's any issues on this, it's important to discuss this with your physician, to remind them, if they don't understand, that there are guidelines presented for opioid prescribing, and if that doesn't get you anywhere, then it's perhaps important at that point to speak to the licensing body that this physician has his license or her license with, to get their attention to understanding this complicated process. In defense of the physicians, it is complicated. A lot of physicians didn't understand we were not well educated on opioid prescribing in the beginning, and a lot of physicians just don't have the experience with weaning patients, and they can get become defensive, and it doesn't excuse any physician though for being unprofessional, but certainly it's important to point out that it is inhumane to suddenly stop somebody off their opioids. So to summarize, the effective answer to can my physician suddenly stop my prescription, the answer is no, they are not supposed to be doing this. Instead, they should be following the guidelines that suggest weaning you down to a safer level of opioids, and also to initiate other additional treatments to help deal with pain. If you have any questions, please leave it in the comment box below.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.